Well, good afternoon, everyone. Prynawn da. Bawb, a croeso cynnes iawn i'w webinar Gofal Sylfaenol Gwyrdach Cymru heddiw. Kate Eden ydw i, is-cadeirydd Iechyd Cyhoeddus Cymru, a mae bleser mawr gen i gadeirio'r cyfarfod heddiw. Diolch yn fawr i chi gyd am eich amser prynawn 'ma. Good afternoon, everyone, and a very warm welcome to you all. I'm Kate Eden, I'm Vice Chair of Public Health Wales, and it's my absolute pleasure to welcome you all to this Greener Primary Care webinar this afternoon. It's great to see so many of you here with us, and thank you very much for giving us time in your very busy diaries. So the Greener Primary Care Framework and Awards Scheme launched nationally last June, and since then we've had over 100 primary care practices register from across all 4 contractor groups and all 7 health board areas. And for all those who've been involved to date, and I know there's quite a few of you on the call this afternoon, thank you for all of the work that you've done so far to support the development of the framework and the pilot sites. But today I'm delighted to say that we're relaunching the scheme, the framework for 2023. And I'm even more delighted that Eluned Morgan, our Minister for Health, launched the framework with a statement in the Senedd on Friday, congratulating everybody on the progress so far and looking forward to what we can achieve together this year. So this lunchtime webinar has a couple of purposes: to reflect on the progress to date, to look forward ahead to this year's scheme and the changes that we've made to make it easier to use, but most importantly, increase the impact that we're able to have to improve the environmental sustainability of day-to-day primary care practice and reach the Welsh Government's decarbonisation targets. So this afternoon, we're going to hear from Welsh Government on how the framework aligns with their strategy and policy for climate change. We'll have members of the Primary Care Hub team here with us at PHW to look at the 2023 scheme in a bit more detail. We've got a demonstration of the new Green Impact Toolkit from Celine, our external partner SOS UK. And we'll also hear some reflections from practices on how they've found the past year. And finally, we'll have some time for questions at the end. So please do put anything you'd like to ask in the chat bar, and I'll make sure we do a roundup of any questions at the end. So a final piece of housekeeping from me. We're recording this meeting today to put it up on the Primary Care One website, so it's stored there for those who weren't able to join us this lunchtime. So if you don't want your picture featured on the website, keep your camera off, and in the usual way, if you could mute your microphones unless you're speaking, that would be great. We're going to circulate all of the slides in a post-meeting pack in the next couple of weeks after the meeting. So, having said all of that, I'll turn to the first item on our agenda this afternoon, and I'm delighted to say that we're joined by Anne Corp from Welsh Government. So, croeso cynnes iawn I chi, Anne. Very warm welcome to you. I think there's a couple of slides that are coming up, so I will hand over to you. Diolch yn fawr, Anne.
Diolch yn fawr, Kate. Okay, prynhawn da pawb. Good afternoon, everyone. My name is Anne Corp and I work at Welsh Government in the Health and Social Care Climate Emergency National Programme team. And there I have oversight of the programme's decarbonisation projects. So mae'n bleser mawr bod yma heddiw a fod yn rhan o sesiwn ma I lansio ail flwyddyn y fframwaith a chynllun gwobrwyo Gofal Sylfaenol Gwyrdach Cymru. It's really great to be here today and to be part of this session to launch the second year of the Greener Primary Care Wales Framework and Award Scheme. The climate change emergency and the health of our population in Wales are inextricably linked. The climate emergency is a health emergency. Without action, climate change will impact on the delivery of our health and social care services, harm health and well-being, and put vulnerable people at further risk, widening inequalities. Inaction is not an option, and as a nation and as a health service, we're committed to achieving our decarbonisation targets. In 2019, both the Welsh Government and the Senedd declared a climate emergency. The Welsh Government's net zero plan sets out an overarching and legally binding target to deliver net zero emissions by 2050. Alongside this is the ambition for the public sector in Wales to be collectively net zero by 2030. Published in March 2021, the NHS Wales Decarbonisation Strategic Delivery Plan provides a route map for our contribution to the 2030 ambition. It is a clear mandate for action, setting out 46 initiatives for decarbonisation across the highest emissions areas. So, what can primary care do to help tackle climate change? The vast majority of the contact that people have with NHS Wales is via primary and community care. These local services will therefore play a vital role in tackling climate change. The first of its kind in Wales, the Greener Primary Care Wales Framework and Award Scheme is designed to support GP practices, community pharmacies, dentists and optometry practices to take action against climate change. The framework closely aligns to our legislative and policy context in Wales, for example, supporting the ambitions of the NHS Wales Strategic Delivery Plan. By signing up to the framework, primary care contractors are committing to improve the environmental sustainability of their day-to-day practice and to help reach the Welsh decarbonisation targets. The decarbonisation of the NHS in Wales does not just lie with NHS staff. We need the public and patients to help too. By promoting the actions they have undertaken in adopting the Greener Primary Care Framework, primary care contractors play an important leadership role in raising awareness of the climate emergency and of actions that can reduce emissions. Since the Greener Primary Care Wales Framework and Award Scheme was launched by Public Health Wales in June last year, more than 100 primary care practices have registered on the framework and completed a total of 638 climate-friendly actions to reduce emissions. I'm grateful to everyone who has participated in the scheme so far and to everyone joining the scheme or expanding their commitments this year. These actions will make a difference to this really important decarbonisation agenda. There's a really informative session planned for this afternoon, and I look forward to hearing more about the scheme and awards. Mwyn cyrraedd ein targed zero net, mae angen I ni I gyd weithio gyda'n gilydd I leihau allyriadau. Diolch yn fawr iawn I bawb yma heddiw am eich cyfraniad I aerial dros Gymru wirddach tegach. To achieve our net zero target, we all need to work together to reduce emissions. Thank you very much to everyone here today for your contribution to advocating for a greener, fairer Wales. Diolch.
Diolch yn fawr, and thank you very much. That's a great way to kick us off this afternoon. And thank you for that reminder of the climate justice targets set out so clearly by Welsh Government. And also a great reminder to us all and a call to action that inaction is not an option at this point in time. So diolch yn fawr iawn. And we will turn next to our next presentation to talk us through a look ahead to the 2023 scheme on the relaunched framework. So Sian and Harad and Hugh from the Primary Care Hub team here at Public Health Wales will talk us through the next 10 minutes or so. So Harad and Sian, Hugh, over to you. Drosodd chi. Diolch yn fawr iawn.
Thank you, Kate. So I'm going to start. So hello to everybody on the call. Some familiar names and faces. So thank you for coming back on board, and some new names and faces as well. So you're very welcome, and it's great to have people listening to what we've got to say today. So as Kate said, I'm just going to spend about 10 minutes or so, or collectively on Harad and Hugh and myself, to tell you about the scheme itself. So for some of you, this might be going over old ground, but I still think it's helpful. but also in particular the fact that this is the relaunch, so we're moving into year 2. So as I said, some of you on the scheme will know a little bit about this on the call because you've been part of the scheme for last year. But I am conscious that there may be some newbies here with us, so we'll assume nobody knows anything at this stage, okay? So rather than me sort of spend death by PowerPoint and go through lots and lots of slides, we have developed an animation that hopefully will explain what the scheme is all about. Now, we're going to play this in a second, but during our trial run this morning, we did have a few technical hitches and it was a bit glitchy. So we'll give it a go and we'll try and see whether it plays well. It is available, or it will soon be available on our Greener Primary Care Wales web pages. So if anybody is finding it really hard to follow, I will post the link and maybe you could have a look through that route. So we'll start with that. But before we actually go on to it, again, I just wanted to stress that this is year 2. So we have had some experience in the first year and worked with you know, a small but significant number of practices across Wales to sort of help us refine what we're doing for year 2. So let's play the animation and then we can see what happens after that. So Holly, it's over to you.
The Greener Primary Care Wales Framework and Award Scheme was designed to help primary care reduce its environmental impact. In 2019, Wales was the first parliament in the world to announce a climate emergency. At that time, NHS Wales produced over 1 million tonnes of CO2 equivalent every year, the highest in the public sector. Our climate in Wales is already changing. This affects us all and can negatively impact on patient and population health and well-being. It can also make it difficult to deliver primary and community healthcare services. We can all help by acting now. To do this, we need to work together to collectively reach the Net Zero Wales ambition. We're inviting teams from across general practices, community pharmacies, primary care dental surgeries, and optometry practices to join others who are already taking action to reduce their carbon footprint by registering with the Greener Primary Care Wales Framework and Award Scheme. The framework contains a variety of actions to choose from to suit your interests and is tailored to your practice's circumstances. Suggestions and resources on how to start combating climate change are provided. Getting involved is easy. It's free, available online and open to all members of staff. Just register as a team, select which actions you want to work towards and upload evidence to prove that you've completed them. This evidence will then be used to recognise your achievements with an award. You and your team may even be thinking about or doing some of these actions already as part of your personal, professional and organisational duties. In taking part, you'll be leading the way for your profession, making small but significant changes to create a larger cumulative effect. Visit Greener Primary Care Wales to find out more and register using the registration code 44247. The Greener Primary Care Wales Framework and Award Scheme, helping you to take action to reduce the harmful effects of climate change in Wales.
Thank you, Holly. If we could have the next slide. So hopefully that animation gave you a flavour of what the scheme is about. It is open, so it's officially launched again today. So anybody wishing to register will be able to do that from today onwards. For those who may have not seen the link or the codes, all the information will be on our web pages. So we'll keep sharing that with you during the webinar and beyond. So don't worry, it's not a case of writing it all down now. So what I wanted to spend is just a little bit of time and a few slides going over last year and the teams that got involved and the numbers and what we learned from it. So this is just a very simple graph that explains to us the proportion of practices across the 4 settings by health board setting. But if I draw your attention to the very final columns, which are the totals really, what this tells us is that we had uptake from every area in Wales. So from all health boards, we had contractors from the majority of settings taking part. We did tend to have more general practices engage in this scheme than any of the other settings. But when we look at Cwm Taf in particular, there was a relatively high number of dental practices there as well. So, you know, well done, Cwm Taf. We did have fewer pharmacies than we were expecting or that we were hoping for, and we are looking into why that is the case. And we've had some conversations with the Royal Pharmaceutical Society in Wales because the new contract has been announced last year, so there could be some issues around that and pressures within primary care that's stopping pharmacies for taking part. What we would say in particular, though, is those pharmacies that did take part were absolutely exemplar, and one of which achieved a gold award and the other which achieved a silver award. So those that have taken part have done a sterling job, so well done to them. If we move on to the next slide then, please. Fabulous. So this slide has been put together to really give us a flavour of what we call our successes for that first year. And this provides some data and intelligence into our achievements. So we had over 100 practices enrol and register with the scheme. And because one practice can enrol more than one member, because it's not just an individual, it's more of a team effort, we had over 162 individuals registered with us in that first year. We set ourselves a goal of 100, so we were quite pleased that we achieved that goal. More importantly for me is the fact that the number of actions taken across those practices was really impressive. We had nearly 650 positive actions, so that was far more than we were expecting. So, you know, I congratulate every single practice that took any actions. As you see, we did honour the awards. The numbers are not as high as maybe they could be or they should be, but we had a lot of teams that only implemented 1 or 2 actions depending on when they enrolled with the scheme. So hopefully this year we can help those practices sort of move towards the bronze level as a minimum. And I know I've already had some conversations with practices that maybe achieved silver last year and really want to go for gold this year. So it's great that the enthusiasm is there. When we look at the 650 actions, we are in the process of calculating what that actually means for decarbonisation. It is quite a sophisticated and not an absolute science to work that out. But SOS UK, who you'll hear from in a moment, have actually calculated that for only 4 of the 50 or so actions within the framework. And already that equates to, I'm going to get this right now, 44,000 kilograms of carbon dioxide, and putting that into layman terms, that's the equivalent of 4 round the world flights or boiling more than 7 million litres of water. So if you actually put it in the context of that, then, you know, that's really good. And I think I'm really impressed with practices that have done that. So for this year, we haven't set ourselves a target as such yet. But for me, the personal target and what I'll be driving the team for is we want more people enrolled, and we want more of the ones that are enrolled doing more of the actions. So if anybody on the call today know of your own practices or colleagues that haven't taken part within your cluster or within your health board, we'd really hope you could help spread the word and encourage them to do that, as well as yourselves taking action. Next slide, please. So this slide really is a collection of bits and pieces over the last year that we're quite proud of, but also will help you as a practice, whether you're a returning practice or whether you're a new practice, to have an idea of what other people have done last year and ways for us to promote and communicate the scheme. So some of the work has been taken forward by practices themselves. So the image that you can see with somebody's head just above water was an optometrist practice that worked collectively with a couple of other optometrists across Wales who had joined the scheme and had an article published in a national journal around the work that they'd done. And other bits and pieces are work that we've done centrally in the hub. So I'll draw your attention particularly to the web pages, because for me, that's the sort of first port of call. Everything you would need around guidance, further information, top tips should be available on the web pages. And there's also a contact us section there. So if you can't find what you're looking for, then please get in touch with us. And then the green publication you can see on this slide is soon to be published in the next week or so, hopefully, what we've called a yearbook. And it's a collection of about 10 or so case studies taken from the range of practices across Wales. They've been written by the practices themselves, but there's some really good ideas of how you can take some of those actions forward. But quite personal to how it works within the individual practice. So I'm hoping that will motivate people, give people a head start, and kind of think, right, if they can do it, then surely we can do something, because some of them are actually very, very simple, but really effective. So next slide, please. What I should say at that stage is, before I go on to this slide, is a big thank you to Anne and her team in Welsh Government, because they sponsored and provided a grant for us to get that yearbook finished and finalised. So this slide explains where we've come from, really. So, you know, the work actually started way back before year one, but we did launch it about this time last year. And at that point of time, the team had been lucky enough to have been accepted onto a Bevan scheme. It's called a Bevan Exemplar. So we work closely with the Bevan Commission, but we'd also established an expert group, of which Kate Eden, who's chairing this webinar today, also chairs. And that expert group was made up from a wide range of stakeholders, particularly professional bodies in Wales, contractor bodies in Wales, and individual practices, to help guide us through that year. So it hasn't just been a couple of us sitting in Public Health Wales, it's been very much a collaboration, and we've taken a lot of feedback into getting us there. We did pilot the scheme at the start, and then we took a bit of a leap of faith and then launched the scheme nationally. We've awarded those practices for that first year, as you've seen in previous slides. And then we closed for review for a bit of time of reflection to update some of the actions, to prioritise them, make some slight changes. And we now find ourselves in this little box that's got red text around the relaunch. I'm going to hand you over to Anne Harrod, who will hopefully tell you what we can expect for year two, but hopefully that explains where we've come from and where we're planning to go. I will just reiterate during these slides, if there's any questions that you prompt your thinking, please put them in the chat and we'll pick them up at the end. So thank you very much. That's for me. Done.
Thanks, Sian. Can I have the next slide, please, Holly? Thank you. So yeah, I'm sure we can all agree that it was a very busy and successful first year for the scheme and its participants. And so moving on to the year ahead and what's different. The first thing that we wanted to let you know about was the changes that we've made to the framework. Celine Clark from SOS UK will be doing a live demonstration of the framework later on in the session. So I'm going to try not to cover too much of what she might explain. But as you'll be aware, the framework was closed from November to allow us and our expert group to review the actions in the framework and to make changes based on your feedback. This is an annual process that ensures we have an up-to-date and relevant set of actions which will continue to motivate practices. However, this year has been a little different because SOS UK Green Impact on a national basis has also had an overhaul of the platform they use to host our framework. This means that the website will look quite different from last year, but we hope that you'll notice lots of improvements. One of the main benefits of these improvements being an autosave function, which many of the practices from last year had asked for. There's also going to be an ability to filter by theme and mark actions as in progress. We've also listened to your feedback when it comes to the innovation category, and we've added an additional innovation action to allow practices the freedom to implement changes which aren't currently included in the framework. We've also added a new adaptation action in recognition of the need for us to both mitigate and adapt to climate change. This action is quite broad, so hopefully will give you enough freedom to interpret it to meet your practice's needs. Some of our actions also have a take it further suggestion, which is completely optional, but is intended to stretch those practices already at a high level of award. Many of the further information tabs have also been updated to reflect new or changing resources, so I would definitely recommend reading them carefully before implementing your chosen actions. Right at the bottom of the framework, you'll notice a few special awards. Again, these are optional and they don't count towards your points tally, but it's an opportunity for you to nominate a colleague, a team, or even yourself for the great work achieved. Finally, something new which isn't on the actual framework, but it's a new peer support network which we've set up on Gwella. Gwella is hosted by HEIW and is a leadership portal for NHS staff. Last year, we received feedback from teams wanting to connect with others and share ideas, so we hope this new site will facilitate the sharing of best practice. When you register on the framework, you'll be asked whether you consent to us creating an account on Gwella, and if you tick yes, then we'll add you to Gwella and you simply need to claim your account. And in a few minutes, after a few more slides, I'm going to hand over to Hugh for a quick demonstration of the Gwella platform for those of you who aren't familiar with it. Can I have the next slide, please? Okay, so I've just included here 4 examples of the new actions in this year's framework. And I mentioned on the last slide about adding in something on adaptation. So that's our first example here. Secondly is a new action relating to a switch off plan for lighting and equipment. We've also added an action regarding switching your default search engine to a climate friendly alternative. And we've got 3 examples of those search engines for you to use. Finally, we've added an action which allows you to share a case study of your work and achieve 1 point in the process. We really loved reading the case studies included in the 2022 yearbook, and we hope to receive lots more this year. Next slide, please. So I'm conscious that there may be some teams here today who are completely new to the scheme and others who are familiar faces. So for those of you who are joining us for the first time today and didn't register last year, I guess my top message would be to head over to our new website, and as you'll see in the chat bar, we'll be posting the link throughout today's webinar, and it's also on our Primary Care 1 website. And once you're there, to register your team for free. And as Sian alluded to, we want you to get your whole practice involved. This is something that any member of staff can participate in, and it works better if you do it as a team. Then once you're logged in, take some time to read through all of the actions in the framework. You may well find that you've implemented some of the actions already without even realising. Once you've read through all the actions, simply select a couple to get started on and take it from there. So I realise I've probably oversimplified things, but there is plenty of guidance on our website on Primary Care 1, and we're always on hand if you have any questions, and we'll be putting our email address in the chat bar throughout the webinar as well. My message then to returning teams is firstly to head over to the new platform, so not the one that you were familiar with using last year. Again, link will be in the chat bar for you. We've already added your team, so all you need to do is join your team and register yourself as an individual, and that will only take 2 minutes. Hopefully most of the actions will be familiar to you, so start by looking at the actions that you implemented last year and consider if you're still doing them in your practice this year. If you are, then gather some evidence to demonstrate your continued implementation. Then move on to consider what else can you do as a practice? What new actions are you going to try this year? Will it be one of the new actions for 2023? Or perhaps something which was there last year but you didn't quite have enough time to complete? Don't forget, we're always at the end of an email if you need any help or guidance. So that brings me on to my last slide, please, Holly. Okay, so before I hand over to Hugh and then Celine for their practical demonstrations, I want to finish by highlighting the various mechanisms available to you if you do need any help. So as well as being able to email us, we also have an FAQ document on our website, as well as a user guide created by Celine on the framework website. We'll be sending e-bulletins to registered teams, which include hints, tips, and a team of the month. We'll also be hosting optional drop-in sessions via Teams, which is an opportunity for you to ask questions of us or your peers. The first of these drop-in sessions is scheduled for the 25th of April, and we'll be sending a link to all registered teams for that. In the next week or two, we'll be publishing a 2022 yearbook on our website. This is full of real-life case studies from practices registered last year, and I hope that what they've done can motivate you to take action in your practice. Finally, you can go on to the Gwella platform and ask for support from your peers, which leads me nicely into the next section of the presentation. And Hugh, over to you for a practical demonstration of Gwella.
Thanks, Angharad. So yeah, I'm just going to share my screen quickly, and if someone could just let me know once it's shared if it's visible, so I'm not talking to a blank screen.
Is that Hugh?
Brilliant, thanks. So just to reiterate what Angharad said earlier, so this was built in response to last year's feedback. We've looked at different options and we've decided that Gwella was the one that suited best for the requirements. It is totally optional. It is there to help you, and you can use it as much or as little as you like. So there is no obligation for you to sign up, but obviously we would highly encourage that you do. As Angharad said earlier, when you sign up for the actual toolkit itself, there is a tick box to say if you would like your details added to Gwella. Once you've done that, once you've registered on the toolkit, we'll add your details to Gwella, and then you'll receive an email asking you to claim your account. If you have already registered for the toolkit and didn't tick the box for Gwella, and after the demonstration today decide that you do want to be a part of it, just email us and we can add your details retrospectively. That's no problem at all. So just in terms of the demonstration then, once you get the login for Gwella, you will come to this site and simply hit the sign in button. and you'll be presented with this sort of landing page once it opens. If you are a member of other networks on Gwella, you may see a different landing page, but you will still be a member of the network. You then simply go to apps and networks. And again, if you're a member of multiple networks, you will see multiples here, but just look for the Greener Primary Care Wales Framework peer network. All I'm going to do today is briefly go over the different tabs involved and allow you to explore in your own time then. So the overview tab is, as it says in the tin, it's an overview of the network. On here, you'll see a welcome announcement just showing you, just describing the tabs in details that I'll go over today. And if you scroll further down, you'll see a timeline of events. So if you are a member and haven't logged on for a few weeks, you can log into the overview tab and simply scroll down and see what activities have been happening over the last few weeks while you've been away. Obviously, at the moment, we've added a lot of stuff in ourselves, and this will become more populated as and when it's used. The next tab is pretty self-explanatory too, is members tab. So at the moment, obviously, you can see there are only 4 members, and they are the internal team at the moment. As and when people from today onwards, we will be adding people to that network. So that's when this will grow. You can search for any members on the networks, and also you can start conversations with them just by clicking this button here. The discussions tab is sort of like an internet forum, if you like. So you can start and reply to any conversations that people may have. So you can start a discussion about a certain topic. If you want to ask other people's opinions and just see what the thoughts are about there. And you can also answer threads that are currently started. So we've started 2 already. And obviously, once you have your logins, feel free to go and explore those and reply to those as you wish. The files section then includes a number of different files and internet web links that are useful in relation to the framework. So under the action further information folder, we've got a series of web links that you will see in a bit later on that are part of the further information sections on the toolkit, but we've grouped them all into one location here, so it's easy to navigate those. As Angharad mentioned, we will be doing bulletins throughout the year and e-bulletins throughout the year, and we'll upload these here then as well. We've got key documents section, which we'll continue to add to throughout the year, but at the moment we've got animations and our yearbook will go in there soon. And key policies then is just looking at the key policies that frame this framework. So we're looking at the NHS decarbonisation plan, the Future Generations Act, and the UN Sustainable Development Goals. And then the final tab I'll go over is the announcements tab. So think of this as a notice board where announcements are pinned to a notice board. There isn't the same interaction as the discussions, but you can just see announcements. So as an admin team, if there are any announcements we think may be relevant to people on the framework, we'll add these in here and you can see them. We may well push them as well. So if you are a member of the network, when we create an announcement, you'll get an email as well to say that there's a new announcement. The final 2 tabs, modules and requests, are redundant, so you don't need to worry about those. They are just something, unfortunately, we can't remove because of the infrastructure of the network itself, but there's no need to worry about them. There's nothing underneath them. And with that, I believe I'm handing over to Celine. And obviously, just to reiterate that I'm happy to answer any questions on this in the Q&A section later on.
Brilliant. Diolch yn fawr pawb. Thank you very much, everybody. That was fantastic. And I know Angharad said she may have oversimplified. She hasn't. It's really simple to register. It's really simple to get started. So with that, I will introduce Celine Clark from SOS UK. If you're not familiar with SOS UK, they're a fantastic organisation. They are a student-led education charity focusing on sustainability. We've been working with them as external partners over the past year, looking at the impact that the framework has been having. So Celine's going to talk us through now the Green Impact Framework Toolkit and give you a bit of a practical demonstration. So over to you, Celine. Thanks very much.
Thanks very much, Kate. Lovely to meet you all. I can see lots of names I recognise from last year, which is always a good start. So if we move on to the slides, I think they're being shared. Great, thank you. So just as a very brief introduction, I'm Celine. As mentioned, I work for a charity called SOS UK, which is a charity that runs green impact across the UK and internationally as well. It's one of our biggest programmes, and we're very happy to be working with Public Health Wales this and last year on this programme as well. So as a very brief summary of how this programme works, it offers teams a framework to help them support and tackle sustainability issues within their practice. So the idea is, as the staff who work in this place, you're best placed to actually know what needs to change, how to do it. We really want to see that staff-led change from sort of bottom-up approach as well. Throughout the year, you get the chance to implement a set of positive activities, and we sort of give you a toolkit of guidance, which is sort of worked on by SOS UK along with the organisation. So you have a various toolkit of different actions you can choose from, and you can see your progress throughout the year as you tick off actions as you go along. We hope that the programme will give you a holistic view of sustainability. We try and include actions from all areas of sustainability, not just about perhaps, biodiversity, environment. It's all to do with waste, energy, people, cultural aspects of it as well. So it's a very sort of broad range of actions, and you can really choose what interests you and your team when you take part. And just as a very brief background as to how Green Impact started, it started with a student idea back in 2006. It's been running for many years now, and it's since bloomed into a big UNESCO award-winning programme, which we've run across lots of different countries and lots of different organisations as well. So it's really definitely a great programme to be part of. So next slide. So how to join the scheme for this year with Greener Primary Care Wales 2023. Firstly, a bit of introduction as to why you should take part. The fact that you're here today hopefully means that you're interested in sustainability. Hopefully it's something you're passionate about. We've got a few reasons here on screen as to why you should take part. So obviously supporting the Welsh healthcare sustainability ambitions is a really key part of this specific programme. We also really want to recognise staff. We realise this is something you're doing alongside your job, obviously in your spare time. We really want to recognise that you're obviously taking this effort, and we do have bronze, silver and gold awards which you can achieve over the year if you complete a certain number of actions. So last year, as mentioned earlier, we had quite a few practices that managed to achieve these awards. There's also potential to save lots of money and resources depending on what actions you take. Obviously, money saving is not the key part of the programme. The main point is that engagement and obviously having that positive impact on environment. But there is also a scope to reduce some money and resources as well, which can help to convince the higher up people in your practice. We also really hope that you'll make a tangible impact. So throughout the year, you can sort of see and track what actions you've done and hopefully see a difference in your practice, even in terms of cohesiveness. So we do find that a lot of staff report that through taking part in the programme, they really find it's something nice for their practice to do that isn't just work-based. So you can get to know your colleagues, hopefully, and have something fun and interesting to focus on that isn't just your work. So that's another really nice reason to take part, which we've definitely seen, especially after COVID, with staff perhaps being a blend of home working and practice-based working. It's nice to have something else to focus on and positively impact something together. We also hope that you'll get some good practice and working with new people as an opportunity for this. So as Karen mentioned, we do have monthly drop-ins, which are optional, and this can help you get to know new people and also meet other practices across Wales. And finally, a big point of this scheme is to really help you respond to patient and public demand to take part in action on the climate crisis. So obviously this is something that's at the forefront of a lot of our decisions at the moment. We really want to see that positive change, and we hope that the patients and public who visit your practice will also recognise this as you take part. So there are different themes within the online toolkit, as I mentioned, so it really does depend what you're interested in. There's no right or wrong way to complete this toolkit. It's very much up to your practice. So we do suggest, firstly, having a look through the actions, and in any order, you can basically decide what your team's priorities and interests are. So perhaps you really want to work on waste, you want to focus on biodiversity, you'd like to focus on energy. It's really up to you. There's no sort of set list that you have to do in a certain order. So it's very much a flexible scheme that you can adapt to the people in your practice and the sort of personal interests that are there as well. There are 33 general actions which are applicable to all practices. So that means regardless of whether you work in GP or dentistry or another place, you can do those actions because they're applicable to all. We then also have 4 to 5 setting-specific actions, which are specifically for each primary care contractor setting. So, for example, there are, I think, 4 or 5 GP-specific ones, 4 or 5 dentistry-specific ones, and so on. So you can also complete these if you wish to. They are sort of towards the bottom of the toolkit, and the first 33 that you'll see on the online toolkit are applicable to everyone. There is a note at the top if you're not sure who it's applicable to. It says in bold, applicable to all practices or applicable to, for example, optometrists. So do have a look at those. As I said, it's really up to you what you'd like to focus on over the year. So in terms of actually getting onto this new toolkit, for those of you who took part last year, hopefully it'll be a nice change to see we've got a brand new site with brand new software. So unfortunately, we couldn't move everyone across, which means you do have to re-register even if you took part last year. But on the plus side, there are lots of new features, and it's definitely a much more user-friendly, much nicer visually sort of site than previously. So we hope you'll enjoy using it. So you'll notice this is probably the first biggest change. In terms of registering, it's still a very simple process. Essentially, fill in your first name, last name, email, and password. You'll then get sent an email which you have to verify, and that's the sort of verification process we have this year. So you have to essentially click the link in that email to verify your account. Once you've verified your account, you can then log in with that password and email you provided, and it will prompt you to join or create a team. So depending on if you're the second or third person to join from your practice, you might see your colleagues already registered your team, in which case you can join it. If you took part last year, I had a team that was on this toolkit last year. I have added all of last year's names of teams to the new system, but you also need to fill in the team details. So for example, if you're the first person to join from an existing team, you'll have to fill in the postcode, the practice name, health board, etc. for that team, just so we know, all the details are up to date. So essentially depends if you're joining as a first person or not, but either way, do join the team or create a brand new team. If you're brand new, see this year, you can create a new team and ask your colleagues to join the same one. So everyone who joins your team will view the same toolkit. So the way it works, as we mentioned, although it can be individual, we generally encourage it to be a team-based process of sort of team support. So it's not really meant to be one person per practice. Ideally, 2 or 3 or more is great, just so it's not just one person's effort. So if possible, do encourage your colleagues to join, get them interested, show them how easy it is, and do try and get a bit of a community effort going. Once someone's joined your team, they'll be able to see your team's progress, meaning you can all collaborate and delegate actions to achieve your reward collectively. If you want to find actions relevant to a particular theme, so for example, if you want to look at actions relevant to waste, you can use the filter theme, which is sort of on that main page, and you can then filter that just by that specific theme. So to find actions, for example, on biodiversity or carbon management, I think buildings and estates, we have various sort of themes you can have a look at. You can also look at status of actions, so things that have been completed, things that are in progress. And you can also filter by assigning them. So you can also assign actions this year, which is brand new, to a specific colleague in your team. So for example, let's say there's a team of 5 of you, you can choose specific actions which will be assigned to specific people in your team. That's entirely optional, but hopefully a useful tool for some of you. Yes, that's all the filters there. So in terms of completing actions, I will do a mini demo in a second once we finish these slides, just to show you how it actually looks on the live site. But here on the screen, you can see a screenshot of an example action from the toolkit. So this is the first one on the toolkit, which is about adaptation. So you can see it's tagged with a theme, adaptation, in red. If you see that little star symbol on the top left corner, that means you can star it as a favourite action if it's something you'd like to complete. And for every single action in this toolkit, you'll see there's a description. So it will tell you about the action, what it actually is. There's further information along the next tab, which tells you some extra supportive sort of links and things you can use to sort of find out more about the action, how to complete it. Then you've got how you'll be audited, which will tell you what the auditors will be looking for at the end of the year. So it works in a way that once you submit your toolkit at the end of the year, we train up a group of students who will actually look through the toolkit and audit the final awards. So the more sort of information you can put in, it will help us to make sure the audit is successful. And the way you upload comments and evidence is in that comments and evidence section on the right. So hopefully a fairly obvious part to put things. There's a text box where you can type in a comment. So you can put any sort of information to say how your team completed this action. And you can also upload evidence. It's optional. You don't have to do evidence for every single action, but it is really helpful in the audit process. So let's say you organise an event, you might want to upload some pictures or some event page information. If you perhaps did a social media campaign, you might want to put some social media pictures up. You can add meeting minutes. It's really up to you what you want to add as evidence. You don't have to go crazy about adding lots of evidence, but we do encourage you to try and add a bit for each action if possible. And it definitely is up to you what you want to add. Just make sure it's not got any private or sensitive information, of course. Once you've finished completing an action, you can click done on the right. So as you can see, that's there in the sort of orange box you can see on the right there. And that will then add your points to your total tally. So if you want to mark actions as in progress, in the meantime, you can do. And once you've finished them, do click done once you've had all the comments evidence added. So in terms of tracking your team's progress, again, this is something brand new for those of you who were part last year. This is something you wouldn't have seen before. So this year you can see on the dashboard your starred actions, perhaps your favourite actions. You can star them as you go along. You can also see assigned actions. So if an action's been assigned to you, it'll appear on the dashboard page as well, which makes it really quick and easy to find it. And finally, you've got the award progress. So as you can see on the screenshot here, in this case, I pretended I completed 8 actions, which gave me 8 actions, which is enough for the bronze award. So you can see the bronze award is now ticked in green as done, and I'm partway towards silver, which is 17 points or more. So as you go along throughout the year and click done on various actions, you'll see where you are on the award level, which is really helpful and hopefully help you to track your progress throughout the year. If you want to gain silver or gold, definitely welcome to. For most teams that are obviously brand new, bronze is definitely very achievable. So in terms of getting started, I will screen share in a moment just to show you how it all looks. But essentially the first step, as mentioned today by Sean and Cara and everyone else, I think, is to register. So please do go on the registration link. It is in the chat box. And make sure you register yourself and verify your email address, as I said, and then you can join or create a new team depending on your situation. Next steps from that is to gather interest from your practice. As I said, please do try and see if you can get perhaps another colleague on board. It is a really nice programme if possible as a team effort. It definitely makes it more enjoyable for everyone involved. So do try and encourage others in your practice to take part as well. As a sort of first meeting, we suggest looking at the actions together as a practice and deciding on your team's priorities and interests. So think about what skills, what interests are in your team. Is there anything you really want to focus on this year? As I said, it's really optional in terms of what you want to complete. There's no right or wrong way to do the toolkit. So start wherever you're interested, basically, which is a nice part of that, hopefully. We'll be in touch throughout the year with support and guidance. So do keep an eye on your emails. You'll see emails from myself and Hugh as well throughout the year with things like the e-bulletin and perhaps some reminders. So do keep an eye on those. And we will have some drop-ins throughout the year for help and support as well. You'll have until autumn of 2023. The date is TBC, but we should have that finalised pretty soon. And that's when you need to submit the toolkit, and then we'll have the awards and audits process on from there. So keep an eye out on that for the date soon. So if I'm okay for time, Hugh, I'm going to briefly screen share just to show the toolkit quickly. Hopefully we're good. I know we've got a bit of a Q&A section, but hopefully good for time. So let me get my screen up.
Yeah, that's fine.
Lovely. So can everyone see that? If someone could just shout out if that's showing properly.
Yeah, we can see, Celine.
Lovely. So this is how the toolkit actually looks on the live side. As a first brief sort of note, on this top left part here, we've got a little globe. So if you want to see the toolkit in Welsh, please just select Welsh, the drop down, and it will then show you the whole website in Welsh. So just in case that's something that's applicable to your team, that's the little globe at the top. So in terms of actually viewing the toolkit, this is how it will look. So once you've logged in, you've joined your team, etc., this is the page you'll see on the toolkit site. There is some instructions here, so do have a little read through. I'm part of the example team, which is obviously not a real team, but I'm just using it today to show you how it would look. So it would say your team name at the top here, whatever the team name is that you created or joined, that would show up here. As I mentioned, you can filter things by theme, status, and who it's assigned to. So for example, I pretended that I was going to assign a few actions to Hugh. If I click on that, it will show me things I've assigned to Hugh. So there's 2 actions here I assigned to him. Again, if you've had actions assigned to you, you can use that section. The status as well, so you can look at things that are not done, in progress, or done if you wish to. And theme is, as I mentioned, things, for example, adaptation, buildings, estates, and carbon management. If you wish to filter by theme, you can do. Again, it's entirely optional. We do encourage you to first of all just have a read through the entire toolkit before you start filtering, just to familiarise yourself with everything that's here. So if I scroll down to the second one as an example, you've got buildings and estates, which is an action here, and it says it's for all practices. So as I mentioned, that's applicable to absolutely anyone can complete it. We've also added some guidance for actions that were there last year. So if you took part last year, there is some guidance for each action in italics if it was there last year. So you can see if you need to provide any more information or not. You can also favourite the action, as I said, if you wish to have it appear at the top. And you can also assign it to different people. So if you've got people in your team, you can then assign it to a specific user if you wish to. For each action, as I mentioned in the slides, you've got further information which tells you more sort of detail. How you be audited is a little bit of brief sort of guidance, and you've got the comments evidence section. So here you can add a comment, type something in to say, our practice completed this in XYZ way. Here's how we did it. And you can also add evidence files if you wish to, for example, PDFs or photos, etc. It's up to you. Once you've completed the action, just click done, and that will then add that point to your team's progress. You can also click in progress if you're partway through and you want to save that. So that's hopefully a very simple intro. It's quite self-intuitive. I think as you go along, you'll find these actions are quite hopefully interesting, a broad range of different topics. And as you scroll through, you can see each one has those different sections. So I think once you've used the action, used the toolkit a few times, it will hopefully be very familiar to you. If you do have any issues with the toolkit, it is a brand new one. We have just launched this brand new site. So if you do have any issues or bugs, please let us know. We'll do our best to resolve them as quickly as we can. It's obviously a very new toolkit, but we're hoping that it will be a really a big improvement to last year if you were here last year. In terms of other pages, we've also got FAQs on the side, about and contact on this left-hand side of the page. So if you wish to find out some more, definitely do have a look at those pages, especially if you're brand new. The FAQ page is really useful. So if you've not taken part in the scheme before, I would really recommend having a look through this page and actually reading through how to complete awards, how to complete actions. It will guide you through all the process, and there's lots of useful information on this page. There's also a new toolkit user guide which SOS UK has created, which you can see here linked. If you'd like to have a look, it will show you how to complete everything step by step if you're not quite sure. We've also got the About page, which tells you more context on the scheme, and also the contact page, which has my email address here, and also the Greener Primary Care email address over here. So if you need any help, do go to the contact page and drop us an email. So yeah, essentially, hopefully a much sort of easier, quite intuitive toolkit to use. If you took part last year, it definitely wasn't quite so simple. If you're brand new, hopefully this looks exciting to you as well. At the top, you've got the option to change team settings. So if you wish to amend your team, change anything, as you can see, the team details, the postcode, contractor type, etc. That's all. You can change it in this section here. And you can also add new team members. So this is something that, again, wasn't a part last year, but you can now type in an email address and it will send an invite to specific colleagues. So if you want to invite your colleagues directly, do use this add team member section here. You can invite them directly as a new team member. So as you can see here in this team, it's just me and Hugh in the example team. So if you wish to invite new people, do use this feature. And finally, the last bit I'll show you quickly is your own account. So mine here it's got TA on it. It will have your initials. So if your name is obviously something else, that will just have your initials there. You can see your profile here and edit your profile. You can add a team photo if you wish to, or your individual photo, up to you, preferred language and so on. And you can also change your email if you need to. And again, password is also here. So hopefully that will make sense. If you do have any questions or you're not quite sure about something when you're actually taking part, please do drop us an email. We do hope you'll enjoy using it, and definitely do take some time to look through the toolkit. We've spent a lot of time writing these actions and making sure they're hopefully really interesting and exciting for you and your team.
Brilliant. Diolch yn fawr iawn, Celine. That was really helpful. So thank you very much for that. And I think probably people on the call also got a flavour of some of the specific actions there as we saw when you were going through the toolkit. So that's brilliant. Thank you very much indeed. So we've got a couple of questions in the chat, but I'm going to save those until the Q&A in about 5-10 minutes time, because I want to go to some reflections first from practices who were involved in the framework from last year. So just to bring a flavour and bring this to life really of what it was like implementing the framework and some of the actions within it. So Angharad, over to you, and I think you're going to take us through some of these recordings. Diolch yn fawr iawn.
Thanks, Kate. Yeah, so I've just got two short clips to play for you. So the first video is of Julia, and she's a practice manager in Llanfyllin Medical Practice. And then the second two videos are of Tim Morgan, an optician in Buckley Eye Care. Both were selected as pilot sites at the beginning of 2022 and have been great advocates of the work ever since. And here they speak about some of the benefits of being part of the scheme. In particular, its participatory and inclusive nature, and also that it's a refreshing change from clinical practice. So Holly, if you're okay to play both, please.
We very quickly got engagement from the rest of the practice team as something that we could all look at that we found really mattered to a lot of the members of our team. And particularly after a couple of years of dealing with the really acute sort of firefighting work in practice, it was really nice to be talking about something else, something that mattered, greatly to a lot of our team and to our patients, and to be able to sit down as a team and discuss the things that we could start doing fairly easily, that people could all get involved in. And we got really good buy-in from the rest of our practice, and people seem really open to being able to kind of look at little areas that they could take on board themselves, that we could work towards as a practice.
To change to the mindset that is most interesting. When I speak with my colleagues about environmental responsibilities, global social responsibilities, one of the preconceptions I think that a lot of us will face is, well, that doing this sort of thing feels like a luxury. And when you really start going through what are essentially environmental QI projects, it's really apparent how very often what is environmentally the right thing is also the right thing for the patient, and it's also the right thing financially. So please don't look at this as thinking, right, well, we could do it, but what is it going to cost the practice? You may well find that you make financial savings in some areas, but also free up capacity by streamlining and informing then other pathway service decisions more broadly. It is massively refreshing to be doing something creative and innovative, where we often follow set SOPs, set pathways, set governance, whereas here we are looking for creative ideas and solutions. So that's really refreshing. it's lovely not to be talking about COVID. So embrace it, if only for that. It is super equalizing. It is really inclusive, because ideas need to come from everywhere, and everybody in your practice will have their own perspective of your practice. So we'll be able to equally input, and it is a step away from the traditional clinical hierarchy that we perhaps are accustomed to.
Thanks, Holly. So I'm just going to leave you with a couple of quotes from some of the practices that registered last year, and I'll let you read this in your own time before we go on to the Q&A. But really what we'll see here is from these different practices, their call to action and how the scheme helped to focus their minds about what needed to be done in response to the climate emergency. So I'll just give you a few seconds to have a quick look over those, and then I'm going to hand back over to Kate for the Q&A section. Thank you.
Oh, diolch yn fawr, Angharad. Thank you very much. And really interesting to hear those two examples of practices who were involved last year. And you can read the quotes there. I think one of the things that I was struck by being part of the expert working group was the team working dimension to this. Because although an individual registers, they registered the full team who's involved, who wants to be part of this as a practice. And so we had some really powerful feedback coming through around how it was bringing different individuals together across each practice and working together to achieve the individual goals and the awards that practices were coming through with last year. So I think, you know, that's a fantastic thing to be able to demonstrate alongside the environmental and sustainability changes that the framework is showing. So thank you very much to all of our presenters this afternoon. I hope you found that useful and helpful, and just a demonstration really of just how very simple it is to register and start recording your actions against this. So thank you very much to everybody. We're going to go to some questions now, and we've got one. So Victoria, I hope your question in the chat bar around the autosave has been answered. I know Celine's responded to you there. And we've had another question in from Gaynor Jones. So Gaynor has asked around how we're linking in with health boards and primary care divisions to promote and support the framework and award scheme locally. So I'll come to Sian to respond to this, but if there's any more questions from anybody in the audience, please do just put your hand up in the usual way or signal in the chat bar that you want me to bring you in. So Sian, do you want to respond to Gaynor's query, please?
Thank you, Kate. So, hi, Gaynor. I'm assuming you're cited in a local public health team within the health board by the nature of your question. Is that correct? Before I go off on a tangent.
Yeah, no, you're right. Yeah, Prynhawn Dad. Yeah, diolch, Sian. Yes, within the Hywel Dda public health team.
Fab. Okay, so there's a couple of things. So firstly, so we'll have another conversation offline and how we can improve this if this helps. But we have a primary care leads network that meet on a regular basis. So that tends to be a national function in how we share a lot of the work that happens in our hub out to the local public health teams. I'll have to recall who's on. In fact, there was a meeting this morning that I missed. I think Megan comes from Hywel Dda, but we'll have to see who that representative is, because that would be the natural, you know, flow of information. In saying that, following the launch now, we've identified groups of stakeholders. For example, some of the professional leads within the health boards for the different professional groups, as well as local public health teams. And we're going to put some packs together that hopefully we can then disseminate that information for you to help us disseminate it on your patch, if that makes sense. But Gaynor, I'm happy for the team and us to have a catch up after this meeting. We'll put something in the diary if you've got any ideas of how we can strengthen that, because it's sort of helped in some areas, but I'm guessing it's very difficult to reach everybody in every area. The other thing is we have got a very good route in with the heads of primary care and the directors of primary care. But again, whether that connection is happening locally, I think it will just depend on the area, won't it? So let's take it offline, but hopefully that gives you some sense of how we're hoping to cascade the information and connect with you guys.
Absolutely, and diolch for that.
Thank you.
Oh, lovely, diolch am y cwestiwn, Gaynor, thanks very much. Okay, Sian, if you stay on screen for me, because we've had another question in from Nia McVeigh. Nia, would you like to ask your question, or are you happy with me reading it out? There we are, Nia's on screen.
Hiya, I don't mind asking. I'm just wondering, it's very specific around your kind of primary care contractors. And I was just thinking it might put people off. I'm assuming we are allowed as a team to join in with this. We work in community clinics, a lot of us in the paediatrics anyway, and a lot of us work out of some GP surgeries. So I'm assuming that we are encouraged to join in and do some things for our department. But I was just wondering, is it a little bit off-putting that you're just mentioning dentistry, pharmacy? Because I would look at it and go, oh, I'm not sure if we're encouraged to join in or not.
So let me pick that up then, Nia. Thank you. So if you know, the scheme has been designed intentionally for those 4 contractor settings originally. Now, partly because of the way and the nature of the way those contractors work and the contracts they have with the health board and their independent status. So you are right in picking that up. We've had various conversations over the last 12 months around the wider primary care workforce and who's in and who's out. What I would say is for this year, we're still keeping it very focused because it's still very early stages with this scheme. A lot of the actions would apply. I'm happy to share with you that list of actions. I don't think at this stage your team and your community setting would be able to necessarily join this scheme. But while you're working in the practices, I'd encourage you to connect with those practices and get the practices on board, because a lot of it's quite setting specific, as in the premises as well as the sort of clinical actions. So there's one thing about when you are working in a general practice, how can you help support them and get them on board with this? And how can you be part of that team? And you could be leading that team as the individual in that practice. It doesn't have to be the GP if it's a GP practice, or it doesn't have to be the practice manager. But then there's also something about how you can take the actions and look at them in your other settings outside of that general practice, but not necessarily be part of the scheme at this stage, because it is still very, very focused around those primary care contractors. So apologies for that, and maybe one day in the future with more funding and more capacity, then we can broaden it. But we're still sort of taking very baby steps and learning before we actually make it an all singing, all dancing primary care scheme at this stage. Is that okay?
Yeah, that's fine. Thank you for clarifying. That's fine. We're starting to do quite a bit around green champions and doing some bits, so it's fine. We'll I'll link with some of the GP practices we're working within, at least.
Yeah, and what I can do, Nia, is that we can connect you to the AHP lead, the national AHP lead, because this is obviously something that is an issue for AHPs across primary care generally. You know, lots of people, because I had a conversation with somebody at HIW as an AHP lead recently to say, right, what should we be doing? What can we be doing? We want to share and help as much as we can. It's daft to start with a blank sheet, but maybe this scheme isn't designed necessarily for the practice you actually operate in primary care, because you've got a bit of a sort of more complex way of working rather than it being very set in specific. But I think for you to dip your toe in the water, definitely connect with those general practices and try and get them on board. And if anything we can do to help you, then email in and we'll see how we can make those connections for you.
Great,
thank you
very much.
Lovely. Diolch yn fawr, Nia, am y question and for all of your interest. Thank you very much indeed. Okay, I can't see any more hands up now, so I'm just going to double check with the team that there's nothing else that you'd like to raise this afternoon. Give me a shout if there is, or put your hand up. Otherwise, it just leads me to say a huge thank you to all of you who've come along this afternoon and taken up time from your lunch break and out of your afternoon. I hope you felt inspired by what you've heard over the past hour, and I hope you've heard just how very simple it is to start on the framework, to get yourself registered, to get your team together, and to start taking action in your day-to-day practice, because it's absolutely clear that action on the climate crisis is critical, and there are all small steps that we can all take to make our day-to-day practice more environmentally sustainable. So there is tons of support out there from the Primary Care Hub team at Greener Primary Care, and the email address will be in the chat bar coming up, so please email us if you have any more questions, if you need any more support in any way, and the team would be only too happy to help. So please, once again, spread the word for us, get yourself registered, the earlier the better, so that you can start doing the actions and seeing the difference come through for your practices. And it just remains for me to say thank you very much to all of the team today, to all of our presenters from Welsh Government and from Celine. Diolch yn fawr I chi I gyd am eich cyfraniadau heddiw, eich cwestiynau o'r gynulleidfa, and we really look forward to you signing up and seeing those actions coming through over the next 6 months. So diolch yn fawr iawn I chi I gyd, a hwyl fawr. Thank you very much and goodbye.